This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products, and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
Good morning, and welcome back to the Dental Lab Podcast. I'm Bob Brandon, your host and the general manager here at Keating Dental Lab. I hope you all had a great weekend. My house was not raided, and I hope yours wasn't either. So the three freshmen started school this week at Mater Dei, and it officially kicks off President Owen's year in charge. I know he'll be staying up past 9 p.m. studying hard. Owen and the Senators Griffin and Evan, along with all their other class officers, have planned the first week for the freshmen, including a football game and a dance, which is more than what our country's senators accomplished with the Inflation Reduction Act. This is a classic example of trying to will something into an existence that it's not. An Ivy League school concluded, and I quote, "The Penn-Wharton budget model estimates that the Inflation Reduction Act would reduce non-interest cumulative deficits by $248 billion over the budget window, with no impact on GDP in 2031. The impact on inflation is statistically indistinguishable from zero." An illustrative scenario is also presented where the Affordable Care Act subsidies are made permanent. Under this illustrative alternative, the 10-year deficit reduction estimate falls to $89 billion. So that's a savings of $89 billion over 10 years, or $8.9 billion per year. Great job on that. Hope Congress is patting themselves on the back and taking the rest of the month off. That way they can't do any more harm. Meanwhile, all of us regular American workers will get back at it this week, making teeth, helping sick or injured people recover in the hospital, pumping gas, serving food and meals, or whatever your daily job entails, because that's what we do. And speaking of doing, our very own Sean Keating, the president, founder, and CEO of Keating Dental Lab, turned 60 this week. For those of you that don't know him, Sean is the Energizer Bunny, Steve Jobs, and the Terminator all rolled up into one being. He's the reason Keating Dental Lab exists and is the reason why hundreds of thousands of Americans can smile more confidently and thousands of dentists practice more confidently. So please call in this week and wish Sean the best and a happy 60th birthday. So today, we're going to hear the final podcast recorded live from the show floor of the Academy of General Dentistry's annual meeting in Orlando. We've got Dr. Eric Wong, a trustee who sits on the board of directors of the California AGD, and a live practicing dentist who took a career path that many do not know exists. I'm not going to give anything away, so here we go with Dr. Eric Wong. Good morning and welcome back to the Dental Up Podcast. We are live from the Academy of General Dentistry annual scientific meeting in Orlando, Florida. And today's guest is Dr. Wong from Northern California. Good afternoon. How are you?
I'm good. Good morning in California. Good afternoon here in Florida. Yes.
That's right. It's 9:30 a.m. here on the West Coast. So how was your trip out? Did you get a direct flight, I hope?
I did not, fortunately. So a lot of my colleagues have had travel problems, if you would, in this new age of travel.
It is. Now, you're flying from Sacramento?
I did.
Okay. And do you practice in Sacramento?
I live in Sacramento, but I practice in a city halfway between Sacramento and San Francisco, known as Vacaville, California.
Vacaville, I know that well. I actually went to school in Davis.
Really close.
And spent a bit of time in Sacramento as well. Yeah, Sacramento. I don't know if you're a soccer fan, but they had a pretty impressive win on Wednesday night. They beat Sporting Kansas City in the U.S. Open Cup to advance to the finals.
Yeah, it's a big deal. The Republic FC.
Yeah,
yes, you're right.
It is, and they're going to play Orlando, which is the team. It's an MLS team, and it's in the city that you're in right now. That's going to be a very exciting game. My son's team has played Sac Republic a couple times at the youth level. Very very good club. I'm very impressed with them. It's a very well run club, and they do it right.
I agree, and we in our community support them wholeheartedly.
It was great. There was like was like 11,000 people there on Wednesday. That was fantastic. So tell us what you're doing at the AGD. I know you're a delegate here for the state of California. What's your role for the AGD, and what do you have planned for the future?
Well, I've been involved in organized dentistry and mainly with the AGD since the year 2000. So it's been a good 22-year run. And currently, I am the trustee for California. So I do represent us on the executive side of things nationally.
Excellent. And then how many dentists in the state of California are members of the AGD?
I believe it's 2000 something and not
Wow.
nearly enough. But of
Right.
course, we're tied to the general dentist. And not all general dentists feel the need to be with us, but I wish they would because we advocate generally for the general dentist.
Right.
The ADA, of course, I support them as well. They're a blanket organization with all the other healthcare specialties involved when it comes to dental. So the Academy of General Dentistry is, like I said, advocates for the general dentist, which we comprise about what 80% of all
Right.
dentists.
Yeah, and it's very important. That's a very important distinction, and I wish more general dentists and I wish more new dentists knew that your organization exists, because to me it's truly wonderful. The benefit and the focus on education and becoming a lifelong learner, is truly what this field is all about. And advocating for the general dentist and putting on programs that are specific to the general dentist. Not a big blanket organization that has to treat everybody equally. I mean, that's okay, but the AGD to me is the pinnacle organization for general dentistry, and that's why we as a company and as a laboratory are so proud to be aligned with the Academy of General Dentistry.
Thank you. I agree wholeheartedly. And thank you for saying those kind words and the support that Keating Lab has given our organization as well.
Well, it's about moving forward, and the Academy of General Dentistry has had that in their mission statement forever. That's the role of your organization, and you know, particularly for young doctors. So going back 20 years ago, how old were you when you started with the AGD, and how did you get involved originally?
Well, I had a mentor, and he's still my mentor. I'm glad to say that he's still with us, and he's still there for me.
Excellent.
It's a Dr. Wai-Ming Chan, and he's well known in the dental community. He was one of my dental school instructors at UOP, which I graduated from in 1988. That's Art Dugoni, that is, School
Yeah.
of Dentistry. So I've been out for quite a while, and you asked me how it was 22 years ago. How old was I? Is that
Well,
what
that's
you asked
okay.
me?
We can skip that. That's fine.
Well, I had
22.
that's a little bit of an embarrassment for me because I didn't get into dental school until after I had a different situation.
That's okay.
And I, was in a master's program undergrad. So I would not have met my wife, which was a blessing if I didn't do that.
Right.
So that
Okay.
came. So back to I got started. Dr. Chan, my mentor, kept on coming to my dental office and sat in my waiting room and said, "Can I speak to Eric?" And then he eventually waited, and he spoke with me. He goes, "I need you to come to these meetings, these AGD local meetings at our component level." And then I eventually relented, and the rest is history. I just kind of went along with the program, went through the chairs, became the president of California, then got involved nationally, and here we are.
Excellent. Well, and that's a great story, and that's it. I think it's a very common pathway. Get involved locally and make sure that the interests of the individual dentist and their practice align with the philosophy of the AGD, and then progress to the state level. And I know we've had some meetings down here in Southern California, and we've attracted some AGD dentists from Redding and Chico area and the Bay Area have come down here to our laboratory for some events that we've hosted. And yeah, then you go national. And yeah, I mean, the event in Orlando is, how many different speakers do you guys have for this weekend?
I can't say specifically. I guess I should know that, but I
No,
haven't
that's
been
okay.
involved in that realm. But we have been giving courses here. Three days we will have, actually 4 days: Wednesday, Thursday, Friday, Saturday. Be courses, and every scientific meeting that we have every year culminates with the graduation or the awarding of our fellowship and mastership and lifelong service and recognition awards. So that's something also to look forward to for a lot of the attendees here.
It is. I've witnessed that ceremony twice and been invited from colleagues and Keating Dental Lab customers, and it's impressive. And because it's a commitment. It's a lot of hours that you guys put in on the education side in order to achieve, fellowship and mastership. And it's a commitment to learning. It's a commitment to becoming a better dentist. It's a commitment to treating patients better, and it should be rewarded.
Well, thank you. Those are very kind words, but I would like to rephrase some things, and I'm going to admit to it that a lot of the AGD members are the nerds or geeks of dental learning. They just are really into learning processes that will help you with your scope of services. So that's the way I see it. The more ammunition you have in your tool belt improves your skill set. And once again,
Oh,
that would also benefit all of
benefits
our
pa-
patients.
it benefits patients, absolutely. Yep, because if you only have a hammer in your tool belt, everything
Yeah.
looks like a nail. So you know what? Get out there and learn new techniques, learn as much as you can, because it truly does benefit the patient, and it improves your reputation in the community. Patients will refer, their friends, family, colleagues, everybody. And yeah, you can definitely elevate yourself above your peers in your community if you're an AGD dentist.
Well said. And I would say this too: most of our members are doing this on their own. They're not going to go out there and make this public. It's just for their own benefit as a healthcare professional. So,
Absolutely. Nope. That's the humble nature of being a dentist is, just learning, and you learn for yourself and for your patients, and the patients are the only ones that ever really know about it. And that's 100% fine. Yeah.
yeah,
So tell us about your practice. You have a little bit of a unique practice
I do.
situation. Tell us what that's like.
So basically, roughly 19 to 20 years into my career, I was a private practice dentist. And after that time period, I had an opportunity to join state service. And now, for the last 15 years, I've been a prison dentist.
In Vacaville.
Yes, there's actually two institutions in Vacaville, and they're usually side to side. And I work in the state prison at Solano.
Okay.
The next door institution is a California medical facility, and those are more for hospital-based inmates that are incarcerated there. So I work in the regular one, not the one that treats people in the hospital side of it.
Yeah.
So
Wow.
I've been there for the last 15 years, and the differences are, of course, now I'm participating in a public health model versus a community-based model. There's been a lot of changes since I got there. They have changed in the prison care system for dental care, at least, to more of a preventive or comprehensive care model. It used to be more episodic, emergent type
Yeah.
care nature,
Ex-
but
Extractions.
yeah, and things like that.
Yeah.
We still do that as well, of course. We are the only healthcare discipline in California to pass out of a federal lawsuit mandate. So our mental health component and our medical side, it's the physician and nurses, are still operating under a different model. But dental care have made great strides and have passed out of our lawsuit. So we're no longer in a federally mandated lawsuit model. We, in order to get there, did have to work along with inmate advocates to meet certain criteria to pass out of that. So I'm happy to say for the last 15 years, we have been operating under a very good model, and we've maintained our status and are doing very well.
Excellent.
Well, that's great. I mean, that's great to hear, and that's moving. The California, penal system is moving forward, and it sounds like it's a better environment for you as a practitioner then as well.
Yes, yes.
Good. So what's your day like? I mean, is it do you have a schedule? Is it hygiene and cleanings? Is it restorative? Is it everything?
It's comprehensive care. So in our department, which is the smallest of all healthcare disciplines at our institution, mental health and the medical side have many more people. We only have roughly 24 people working in my department, and some of those are managers that are administrative that have no clinical dental experience, whereas there's other supervisors. I'm a supervisor now myself. I supervise 6 other dentists.
Oh wow, 6. Wow.
Yeah, and we have a supervising dental assistant. We have hygienists. Of course, I had already mentioned dental assistants we also have the dentist. So our department runs on schedules. So we don't call them schedules because in prison it's a different thing. We call them ducket lines. So
Okay.
people get these ducats, the inmates get ducats and they come in for their visits according
Oh,
to the
okay.
times. But we do have regularly scheduled visits, and we also take care of course, emergent urgent care. I do a lot of other administrative functions. I meet with other healthcare leaders, nurses, the head of nursing, the head of physicians, the head of mental health. We also have a person that's our overall boss who watches all of our departments. There's a lot that happens in prison.
Oh yeah. I
It's a
mean,
little city.
you have to have that structure because if you don't have that structure, there's a lot that can go wrong real quick, I
I
imagine.
still do see patients as well, so
Okay.
I'm not, you know, adverse to doing that still.
What are the patients like? Do you think they're more fearful than private practice? Are they more appreciative than private practice? I mean, this is a very unique demographic that you're treating. Um, what's it like interacting with the patient?
I've got to be honest with you, since we don't have finances to discuss, that was one of the big problems when I was in private practice,
Right,
trying to
right.
deal with what it costs to provide the service, right?
Yeah.
We don't have to deal with that. That's one entity that's removed entirely. And to be quite honest with
That's
you,
I mean, and that's a barrier to treatment to
it-
many patients and many
Yes.
dentists. Yeah.
yes, the way our system is set up, we do our best to provide the best care possible, but we do not have to meet certain criteria. I mean, Mrs. Smith does not get to complain about the incisal edge being 1/8 of a millimeter, slightly more on the distal of number than it is on number 9. So we don't have to deal with that. Just to answer your question generally, I got to be honest, it's pretty much easier than to
Yeah,
work on
it's
people
easier than
like-
private. Well, once you get over the fear factor, I mean, to me, I don't think I could ever handle that pressure of, working in a prison. But I mean, I guess if you get used to it, then yeah.
Our patients, once you get used to it, and of course it's not for everybody, it's a different skill set, that you have to deal with a different population, but I think they're very appreciative of our efforts. And for my last 15 years, I'd have to say it's pretty easy sailing for me. Like I said, it's not for everybody.
Right. Yeah. Well, it takes a unique individual to, adapt to that setting, it sounds like you've done it remarkably well. I mean, when I was younger, I was an EMT, and I was always scared of the guys that, were handcuffed to the to the gurney, and because I knew there was something else going on that I had to watch out for. But hey, you're doing a phenomenal service to patients in need, and that's what being a healthcare provider is all about, is putting the situation beyond the care, of the patient. You're just caring for the patient, and you just ignore the situation, and you're taking care of Mrs. Smith or Mr. Jones, or and you're doing the best you can for them, and that's awesome.
Sometimes I have to interact a lot with the custody officers, which I call them custody officers, but other people are going to call them prison guards. But I thank them for protecting us because they watch over us very well. So that allays a lot of the fears that you might presume would be in our environment. But everything is well controlled, and I keep alert, of course.
Yeah,
I
the
keep
people
alert,
the
of course.
people that protect us, our military, our police officers, the custody officers at your facility. Yes, we all owe them a debt of gratitude
I do
for keeping
personally,
up
for
safe.
certain.
Yeah, yeah.
Yes.
So what was it like? I mean, we heard down here. I mean, obviously, the prison system, statewide, especially during the pandemic with everything. Man, I heard some horror stories. What was it like up in Solana?
Well, they had, of course, had to pivot like everyone else, and we had to meet regulations that are necessary. We've had many iterations in our program change, and we try to provide the most services possible given the analysis dealing with the risk and benefits, of course. Yeah, we're back to normal pretty much now, but we did have to adapt a lot, and there was many months when policy keeps on changing.
Mm-hmm.
I don't know any other way to coin that phrase, but
Oh, you just
my
have to
brother-
adapt.
yeah, the brotherhood outside had to do the same.
Right.
Livelihoods were in the balance at one point. I'm glad to say they made a strong recovery. My other colleagues on the outside. So.
Yeah. Well, Dr. Wong, thank you so much for your time. I mean, this has been great. I appreciate what you're doing for the academy. I appreciate what you're doing for the state of California. Just one last question. What kind of advice would you give to a young dentist that's just starting out in this profession?
I have a lot of thoughts about that. As a matter of fact, the AAGD, during all of our scientific sessions like we have right now, we have a new dentist area that's dedicated just to young and new dentists, as well as the AGD does have connections in California with every dental school that's in existence. So
That's
we actually
great.
have outreach through this fellow track program where we talk and we mentor and we allow students in every dental school to give their own courses, and we support that. We have a coordinator. Her name is Dr. Cheryl Goldisich, and she teaches at USC Dental School, and she's our leader when it comes to the students. I also wanted to mention that there's a new dental school, California North State University, in my neck of the woods, in Elk Grove, California. So
Oh, wow.
the AGD does have outreach to the dental students, and I want to answer your question. What would be my advice for young dentists? I know it's a bigger challenge out there for them coming out of school than when I did way back 30 something years ago. The costs and tuition, the debt service that they have, the burden that they will have, most of them coming out is a big hurdle for them to.
Quite high.
Yeah, it is quite high because of the nature of the environment that we are working in right now. A lot of the career opportunities and pathways have changed. Not so much hang your shingle and go for it. A lot of them have to be associates in the beginning. So back to the advice. Once again, I'm not pitching AGD necessarily for this, but you can get dental education in many, many ways. And I would strongly suggest that the younger dentists learn as much as they can, as soon as they can, so they can get to where they want to go. Because if you don't have the skill set, you can't provide the service.
That's great advice. I think that is summed up perfectly and succinctly, and it's advice that any dentist, whether they're going to be a general dentist or a specialist, should take to heart.
Yes, that's what I have. I wish everyone the luck that they would attain what they need to achieve their goals. But the profession has been very good to me.
It is a great profession. It's challenging. It's extremely rewarding for those that have a scientific brain and have the hand skills and the eye for it. It can be the most wonderful profession there is, I believe. And
well put.
Okay. Well, Dr. Wong, thank you so much for your time. Enjoy Florida. Enjoy the AGD. Again, thank you for all your contributions to this wonderful organization. And again, all of us here at Keating Dental Lab, we are so proud to be aligned with the AGD and all its members.
It's my honor and privilege, sir. Thank you, Bob.
Thank you again, Doctor. Be well. Take care.
Thank you for listening to the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.